So we're going to turn our attention now to our next group of beautiful, beautiful community individuals with the topic of Master Plan for Aging Community Provider Insights. There's so much wealth of information and talent coming in with our panelists today that you don't want to miss a minute of it. So coming up now, Elaine Benwell with Elder Services from the Corning Healthcare District. Rosa Deming, who is the Northern Region Supervisor for Maximus California Healthcare Options. Lauren Kennedy, who is the Executive Director of the North Valley Housing Trust. And Tiffany Rowe, who is Program Manager for Butte County Department of Employment and Social Services. So ladies, we'll give you a moment to make sure that you're live and your speakers are working properly. So if you could just say hello to our attendees and guests today.
Hello, hello.
Good morning.
Hi, Elaine. Good to see you.
Great to be here.
Hello, hello. Good morning to everyone.
Good morning, Rosa. Thank you so much for joining in. And Tiffany, I see that you're in as well.
Good morning, everyone.
Good morning. And last but not least, Lauren.
Yeah, good morning, everyone. Thanks for having me.
Absolutely, our pleasure. So lots to continue with this group as well. And with each of you, we're going to focus on your thoughts on how we can achieve some of these goals that were just introduced with our opening guests, Christina and Debbie. Now, Tiffany, I'm going to jump in and start with you because as program manager for the adult services here with the Department of Employment and Social Services, one of the things that I know that you are responsible for is what's called our County Quality Assurance and Program Integrity Unit. Can you help us understand the importance of that department and how it would filter down to this grassroots community level where services are concerned?
Sure, absolutely. Good morning, everybody. Thanks so much for having me join you today. Our quality assurance and our program integrity unit is functioned and housed within the in-home supported services program. And so they have a built-in, it's a statewide system. It's mandated through CDSS through the state level. But we here locally are taking an active role in how we are engaging with our current IHSS recipients and where their needs are, taking a look at those and trying, the hope is that looking at some of those unmet needs that we're uncovering, doing those quality assurance reviews to see how we can collaborate with some of our other community partner agencies. The excitement about the Master Plan for Aging for me specifically, as well as for the entire division within adult services, is really how we'll be able to expand our opportunities for additional collaboration. We have some amazing resources here locally in Butte County, and it's exciting to get back together, although via Zoom right now, and being able to have meetings of the minds and really trying to enhance our service delivery to make sure we're meeting those unmet needs locally within our community, and that we're really aware of the networking that's available. The hope with Master Plan of Aging is to help break down some of those barriers and some of the unknown. With folks in our community are struggling to access what's available to them. So the hope is that moving forward, we can minimize some of that for the folks that we serve.
That's perfect. Thank you so much for addressing that. So I'm going to jump now to Lauren with a thought. Lauren, knowing that the role and activity of the North Valley Housing Trust is to facilitate sustainable, independent funding for locally driven affordable housing solutions here in the North State, we all know how critical housing remains throughout our state, and especially here in the North where we've been ravaged by so much calamity with the fires. Can you help us understand what you believe is still important for us to bridge in order for affordable housing to really now blanket our communities?
Hmm. Um, it's a big question.
It is. And you
And
have 5 minutes. I'm
oh,
just kidding.
so concise here. What is necessary? We have the first thing would be to remove some of the roadblocks so that the resources that we do have, both from state and federal funding sources, from agencies already working, and also resources of just people collaborating with ideas, remove some of the blocks to affordable housing. These include some policy and zoning decisions in different regions so that it's easier to make the changes to housing so that it can be flexible to accommodate keeping people in place, being close to transportation and services. The other thing that we will need for affordable housing in general, and this is more long-term, is keeping an eye on the federal government that currently spends 4 times as much on high-income housing as it does on low-income housing for our country. We'll be watching this administration to see how that changes. And personally, I think the last thing is to get more people involved, more foundations, more businesses, more banks, more, I believe everybody can play a role in creating the housing that we need. And if we shift this frame from housing looking one way to understanding that housing is a reduction in transportation costs, housing is a reduction in healthcare costs, housing is a community benefit, basically shifting from housing as an investment to housing as a public service. I think we'll find more ways that more people and agencies can participate. And honestly, I think that would be the most important shift for providing more housing.
Awesome, thank you. And of course, we'll have a little bit more time to discuss as well. I just want to introduce each one of you as panelists, and then we'll talk a little bit more as well. Let's move, if we could, to Rosa. And Rosa, you're with Maximus California Healthcare Options. And I know that part of your role is making sure that the plan's beneficiaries are getting the most updated information. Now, part of a role in our community as an ADRC, forming that in the North State, would mean that information is a critical key. So speak to us a little bit about why that's a focus for you in your assignments with Maximus.
Yes, it is. And hello, everyone. It is very, very important for us, for me as a supervisor, to be involved in all these projects and with all these organizations, because we need to have all these resources available to provide information to beneficiaries when they come in. We work very closely with all the community services, but also in regards to the plans, once the beneficiaries become a member of either plan, whether it's Santo Blue Cross or California Health and Wellness, we also help them navigate all the services that the plans offer. And listening to everyone here, I know that a lot of the work that everyone is doing is also the work that my ESRs, help out with, because we provide guidance to go to the plan and get transportation services, for example. I know that you've been talking about that. The plans offer that, and we help them navigate how to get those services. There is a process that they need to follow. They need to schedule appointments, and we provide all that information to them during our overview of the program and how to become members of the plan. They offer meal services, mental health services, and all these things, you know, the clients, they figure, well, I become a member of a plan. I know that I can see any doctor I want. But they don't realize that it's very inclusive. There are a lot of other services. So part of our job is to educate the beneficiaries, you know, about all of these resources that are available to them. So we don't limit our services just to enroll them into a plan or disenroll them, you know, or change providers. All of these other services that are provided through the managed care plan, we help them out, you know, to have access to all of that.
And I think that's what's really so critical right now, Rosa, because one of the things I know that you also work on that realm of, you know, and we're going to switch over to Elaine in just a moment here with this thought, because, you know, we're dealing with a time when so many are dealing with emergency preparedness and depression and mental health. So facilitating their access to these programs and to this coverage is really super critical. So thank you for those pointers, Rosa. And Elaine, if you could kind of step in here, because your role in functioning has been all about health and well-being and personal safety, and making sure that it's that whole person that's being cared for. Can you talk with us about why you're choosing that arena and how it's impacted you over the years servicing the community?
Oh dear. How it has impacted me.
Gotcha.
Yeah. I was a caregiver. My father had a stroke and was paralyzed for 5 years. My mother had a stroke. I cared for her for 11 years. And during that time, I worked part-time in elder services. And so I know it from professionally as well as personally, from both sides, as the role of a caregiver and as part of the sandwich generation. My biggest concern, I think, is that, you know, the Older Americans Act was passed in 1965, and we've made precious little progress in over 50 years. I don't think that the state and federal safety net has really kept pace with the poverty levels. And the biggest problem that I see is people falling through the cracks because they don't qualify for Medicaid, or they don't qualify for a lot of the help or the programs that are out there. And so I stepped in trying to fill some of the gap. I initially started doing diabetes support because in the service area that we have, which is the South County part of Tehama County, because there were some support programs or groups. St. Elizabeth, for example, had one in Red Bluff for diabetes people. But, you know, if you're elderly and you're ill, and transportation being what it is, you can't get there sometimes. And so I decided to start taking some of the information and the services to to meet people where they were. And, you know, Florence Nightingale, housing, it all kind of, to me, revolves around the housing issue, because Florence Nightingale said maybe 100 years ago that the health and the dwelling of the population is the most important connection that exists. You can't access home and community-based services without a home. And housing and nutrition and transportation are key social determinants of health, and they're inextricably linked. You can't separate them. And so my goal basically was just to, you know, you can't be all things to all people, but trying to meet as many needs for the whole person, helping people become their own best advocates whenever possible, giving them the information and the tools and the resources that they need, and trying to step in and assist when they can't help themselves.
Absolutely, that's a critical element. Now, I want to give each of you also opportunity to just speak to your day-to-day work. So I'm going to start with Rosa. Rosa had a handful of slides that she wanted to make sure she shared with the community, and then we'll go to each of you so that you have opportunity to say what was important for you in coming in today beyond those brief questions that I presented. So Rosa, if you could jump back in. Thank you so much, Elaine. We'll circle right back to you. But the Healthcare Options Program is one of those programs that's obviously targeting the low-income community. And it's a critical program that we feel maybe everybody needs to know about. And in future sessions, we'll give opportunity for any of our healthcare programs in the state to come in as well. But Rosa, take the floor for a few minutes, 5-6 minutes or so, and talk to us about this California Healthcare Options.
Yes, so California Healthcare Options is a state funded program. It's managed by, our company is Maximus, but our program is focused on assisting everyone who is applying for Medi-Cal. Anybody who applies for CalFresh and they're eligible for Medi-Cal, we assist them with doing this, what is called the second step, which is becoming a member of the managed care plan. So there are two classifications of our population, those that are classified as mandatory and those that are voluntary. The mandatory are people who receive CalWorks, Medi-Cal with no share of cost, or senior or persons with disability, which is obviously, this is, the focus here on our conversation today. We the day-to-day activities are basically making calls on behalf of the clients, assisting them with the enrollment process, updating their doctor. A lot of clients don't know that they have been defaulted into a plan because, they didn't receive the packet. They received the packet and they thought, I don't need this because I already have Medi-Cal. But managed care plan is attached to Medi-Cal. So now the majority of the providers don't provide services under the regular Medi-Cal. They require the client to be in one of the health plans, which is either California Health and Wellness and or Anthem Blue Cross.
So Rosa, I want to make sure our attendees are understanding this element, okay? It's not just enough to be signed up, but you require to take it one step further and get connected to a plan, correct?
Yes, that is correct. So they come in and apply for the benefits, for Medi-Cal benefits, but then they have to go with the second step, which is selecting one of the two plans. And I want to say that we work, we are so thankful to the county people because they help us so much in directly referring the clients to us when they come into the sites and, apply for Medi-Cal or do updates or do renewals. The caseworkers are wonderful people who refer them directly to us so we can help them navigate in the enrollment process for the plan, which then they have access to all these other services I mentioned earlier. So our day-to-day activities are basically helping the client resolve any issues they may encounter in receiving all the services they need.
Excellent. I mean, it's nice to break that down and help everyone understand what it is that they require to do.
Yes.
So, and if an individual is challenged in making that process happen for themselves, where is the best place for them to go for assistance?
So if they have a speech impediment, they can call our TDD line. If they come to our office and request, say, like if they have a vision concerns, then we can also help them request special documents packet from our company and from Healthcare Options, and they can send them information in Braille, for example. So we've tried to figure out the resources that are available to them if we don't have them offhand at the office. And yes, I saw a question asking, is this service free? Yes, this is totally free because it's funded by the state. Our company has the contract with the state to manage this part of services for medical beneficiaries. So it is totally free to them.
Thank you for that, Rosa. And I'm seeing another comment coming from Tatiana, and the comment says Medi-Cal managed care plans are optional for aged and disabled program if they're not receiving HCBS, that it's currently not mandatory. Can you talk a little bit about that, and of course help our general audience to understand that acronym of HCBS?
So when the program just got started in 2013, what is called, the expansion project, they were voluntary. As of about 4 years ago, seniors and disabled became mandatory per the state requirements. However, if they do want to remain on regular Medi-Cal, there is a process to follow, and they can do an exemption form. Or if they do receive Medicare and Medi-Cal, we refer to them as Medi-Medi.
Medi-Medi.
They are also voluntary, yes. So they are voluntary, and then they can remain on regular Medi-Cal. So yes, so there are ways for them to remain on regular Medi-Cal if that's what they need to do. However, even if they're voluntary, if their provider is wanting them to be on X plan, then they have to sign up for the plan, because the doctor then needs to submit the billings to that plan and not to regular Medi-Cal.
So it's one of those processes that it's a really good idea to make sure you have someone guiding you, correct?
Yes, that is correct. And that's why my staff, in all those counties that you saw listed there, I supervise 8 counties: Butte, Colusa, Glenn, Tehama, Yuba Sutter, Nevada, and Plumas. And in each one of those locations, I do have a representative that can help them navigate the process. And of course, now with the pandemic, we are doing everything over the phone, but they are able to enroll the client right there on the phone too, while they're conversing about whatever situation they got going on. One of the things that we see the most is that clients were defaulted because they didn't make a selection themselves when they send them the packet. So DHCS give them 30 days. If they don't do the selection, they don't make the selection themselves, then they send them a reminder letter. If nothing happens, then they are defaulted to a plan. And what happens is that they go to the doctor and say they were defaulted to California Health and Wellness, but their doctor only takes Santon Blue Cross. Then we come in and then we help them out to make the transition to the other plan.
Yes, because it's a very confusing process for so many. Thank you so much for breaking that down for us, Rosa. It's very, very helpful. I want to switch gears here now, and I'm going to jump over to you, Tiffany, if I could, please, and then I'll follow up with Rosa, and we'll close out with some comments from Lauren. So that'll kind of be our step in order here. But Tiffany, if I could just jump over to you for a moment, and just the work that you do is so extensive for our county. I mean, you're managing 4 programs, which includes our in-home supportive services. And in addition to that, you're addressing public authority, you're addressing adult protective services and public guardianship. My goodness, so many multiple hats. What have you seen is the greatest impact to our northern community here, especially Butte County, in the wake of the crises that we've been going to with the fires and the pandemics, all of those issues happening? What's going on behind the scenes, for example, with your departments?
Sure, thank you. Unfortunately, here in Butte County, we have endured significant loss and devastation, to our fires and our local disasters. The silver lining and the learning that's come from that is really refocused our energies as far as how can we do things better and or differently than kind of the status quo of how we've always done it. We've been forced to relook at our systems and our programs, you know, given the disasters and what's happened for us here locally. So each of the four programs that I manage currently are all separate and unique, and yet they all are intertwined. They are all servicing members of our community. And so the pandemic has added another level and layer to that. But instead of looking at that as another challenge or negative, the silver lining there is this notion of how can we do things differently. And I think we're really taking a fast and hard look at our programs and our systems. And like I said before, you know, really re-engaging with different community partners in networking and in collaboration. We are working really hard internally of just kind of updating policies and procedures, making sure things are in line with kind of how we're doing business now and how we want to do things moving forward. I'm really excited currently right now in my position to really not only work with the staff in this moment, but then forward think of what does it look like for us in a year, in 5 years, in 10 years, and how do we set ourselves up to even be more successful by servicing those within our community.
Absolutely, and I'm going to ditto that with the work that the Disability Action Center is doing. This is the first time, and I believe it's happening coming off of the wakes of these community crises, that we've been able to work more closely with the county in that outreach effort to be able to connect people to the services. Because if we could say one thing, is that when you are in that condition, you're so despondent, reaching out for help in and of itself is another task, another chore. So when you think about in-home supportive services, one thing that we know has been happening statewide, especially with the pandemic, is that we're losing a lot of those care providers. What's happening in this local region?
Yeah, it's across the state and even nationally. You know, it's really hard with the Camp Fire and the devastation of the Paradise and portions of the Magalia area here locally for us in the county. We lost significant numbers of providers. We have very limited providers in some of our not as populated areas. The pandemic has again added additional layers and issues with that. You know, there's major safety concerns about people coming in and out of each other's homes, recipients who are in desperate need of a provider but are concerned for their safety and well-being, providers concerned about going into homes and worried about what potentially they could then bring back to their families. We are hopeful here with the restrictions being reduced and with the availability of the vaccine much more broadly available, that we'll begin to be able to do some additional recruitment to find some additional providers. Part of that too is the narrative of really speaking positively about the work that's needed and really honoring and valuing those that are providers that are taking care of those that are in need of those services.
Yes, thank you so much. And again, just thinking about that connectivity, we recognized with the Disability Action Center and the DAN Coalition that collective resources and information is so critical in this process. And never before have we seen the level of collaboration that's happening now in our counties. And in Butte County, you go and you see the resource fairs, and there's so many organizations there now ready and willing to service right on the spot the community. And I want to put out there for everyone that on the 24th of the month there will be a resource fair in Paradise, reaching out to individuals that are still in a difficult way on the wakes of the Camp Fire. So on the 24th of this month, if you need any information about that, contact me at Carolyn@ActionCTR, contact Butte County. We want to get this information out there to the community. Thank you, Tiffany. I'm going to jump over to Elaine and give her a little bit of floor time as well so that she can share the thoughts that were important to her today. So Elaine, what message do you really want to get out to our attendees today? Elaine, I see that your mic is on and open.
There it is.
There you go.
There it is. I'm sorry, can you say that again?
Absolutely, no problem. I just wanted to allow you a moment to really bring the message out that's important to you for our attendees today, because I came through the gate with some specific questions, but now I just want to hear your message that you would like to share with our attendees.
Just awareness, just get involved. On a, on an individual level, volunteer, become a part of something. I thought the talking earlier about intergenerational interaction was just splendid. I would just love to see more of that. I think we have isolated, we've isolated our elders. Families don't live the way they used to live, and aging in place is all well and good if you have the supportive services and the support of the community in order to make that happen. And there's a lot we need to do. A lot of it now can be virtual. I think that's part of the master plan for aging, is to bring seniors into the 21st century. And I also used to do computer literacy classes for seniors. I called it the Silver Surfers program. And it's a hard nut to crack, because not all of them really want to do that, but there's just a lot that needs to be done in order to enable people to stay in their own homes if that's what they choose. And we just need, it takes a village. You know, they say it takes a village to raise a child. Well, it takes a village just to support one another. And I just really think that our elders are a treasure, and they bring so much to our community, their wealth of experience, the knowledge that they've gained. There's just so many ways that people can become involved and make things happen, but they just need to do it. And I'm so proud that the governor has, and our government has developed this master plan for aging, but when the rubber hits the road, it's the people that make it happen. And so I
agreed,
like to see people involved. And
yeah,
because with, aging is not, it's a privilege that's not granted to everybody. But for those that are able to age, eventually we're given any luck, God willing, we're all going to be there. And so in a sense, it's enlightened self-interest. But just to mobilize people in the community at the grassroots level to small things, little things have a ripple effect. And, even a mighty oak grows from a small acorn. So even if you just do the little things, it adds up.
Absolutely. And I think that speaks to the theme of what we've been sharing from our presentation today. It's about collaboration. It's about sharing. It's about stepping out of the silos. It's about getting up and being proactive in whatever that means for you, whatever capacity that you choose to engage in. So thank you very much for that message, Elaine. It is so very important. And let's move to Lauren now with the North Valley Housing Trust. And before we jump in there, Lauren, I want to give a nod to a comment that I think just briefly, Rosa, you want to take in, because it kind of touched on your theme there. I've been watching the chat as well as taking a look at everything that's going on, and there's a comment in reference to housing and a comment in reference to the Maximus plan, and it is coming from, let's see, Maximum, this is coming from Francis, looks like, from Francis. It says, is Maximum HCO the same as Partnership Health Plan in Shasta County? And if not, who's representing Shasta County? So could you briefly come in and answer that thought there, Rosa, as we move
Yes.
into Lauren's comments?
Of course, yes. So no, Shasta County is not part of healthcare options. Healthcare options, we end up in this area, we end in Tehama County. Shasta County has a different managed care plan. It is the same company, but it's managed by somebody else. I do not know who the representatives in that area are, but I can definitely research that and provide that information through Caroline or Sarah.
That'd be
So,
perfect. And that
yes.
was coming from Francis Cole Boyd. So thank you for that thought, Francis. And whatever information Rosa passes to me, we'll certainly get it to you. And you're, of course, welcome to put your email into that chat box if you'd like to just get that communication directly with Rosa. Now, I also had a screen with Rosa's email, so let me pop that up if you want to note that down, Francis, as well. There is Rosa's email, and you can certainly communicate with her directly with your question.
And I just want to add, you can definitely forward that document that I sent to you, Karen. You can definitely forward it to
Oh,
everybody.
perfect.
Yeah, so they can have that contact information. Yes.
Thank you so much, and thank you for the question, Francis. We're going to turn now our attention to Lauren with the North Valley Housing Trust, and there is a question that is specific to your cause, Lauren, and that is coming from Lisa West, an attendee today, and she is asking, are there current plans to build more low-income housing in Butte and Glenn counties? So that's a segue right into what you would like to share today, Lauren.
Thank you, CJ. If I did this correct, to answer that question, okay, so in the chat box, I'm sharing a link, which is the shortest answer, one short answer to that question. That's to the Butte County Association of Governments 2020 Regional Housing Needs Assessment. If you want to go and see what, I'm less familiar with Glenn, but if you want to see what Butte County found in their research for 2020, what our regional housing needs are by income, you can go there. Now, as far as plans to actually build it, you'll see on that needs assessment in Butte, again, this is just for Butte, I'm less familiar with Glenn, there is a need for about 3,300 low income or extremely low income units. We currently have plans to build a maximum. The top count I've heard is about 1,600 of those units in Butte County over the next 5 years. And this is because of a windfall of tax credit financing because of the disasters in our county. So we definitely celebrate those hundreds or maybe over 1,000 units. And as you can see from the data, that still leaves us with a gap of about 2,000 currently. Great, so we can skip that chunk of what I was gonna talk about. I wanted to just say thanks CJ for always bringing such human wisdom to these discussions, constantly reminding us of things like as we come from and discuss these issues as marginalized groups, that it's really hard to do this work. We discuss the problems, but it also takes this human toll that compounds, and just appreciate your acknowledgement of that. Thank you, Debbie, for sharing what you shared. In a slide deck that I have about multi-generational living, there's a project from Portland, but I'm gonna come to you so I can use your project instead. And I wanted to thank Christina too for your comment about disability data. I did notice, and I'm a person who loves data, and we have a lot of it in housing. Recently in Berkeley, somebody just spent $40 million on another research project, and I just thought, oh God, if you went to somebody who needs housing and told them that they just spent $40 million on research, I can't even imagine. But
Seriously, yeah.
like, ask someone without a home what causes homelessness, and they'll tell you it's not having a house. But I appreciate you calling out the fact that there are these data sets missing. And in looking at all housing data, which is not good, I know that within those numbers, I'm constantly conscious of the fact that there's also a racial gap in there. So as bad as numbers are, I know that those numbers get worse for non-white households. I know that as bad as numbers are, those numbers get worse for seniors. I know that as bad as those numbers are, they get worse for disabled people, although you're right, we don't know quite as much about how much worse it gets. And then I also, this is where it gets even more personal for me as an old millennial. I know that as bad as numbers are for seniors now, my generation has much less wealth overall than our current seniors did when they were the age of my generation. And we are also the biggest workforce. So as we plan for what happens in 20 and 30 years for aging populations, the current failures we have will escalate because our seniors of the future are already in worse straits than our current seniors are. So yeah, I just wanted to give those shout outs and thanks. My big message, all right, I'll go back to the beginning. So I'm the executive director of the North Valley Housing Trust. We are a nonprofit lender to facilitate affordable housing in the North State. We were created in 2015 to address a shortfall around $10 million that left our county when RDA funding was cut. We have done one loan for Valley View Apartments. We are currently working on an RFP for a 1-acre parcel that we have in Orville, and we have a small lending pool that we'll be looking to put towards a project for construction, pre-development. And then our job is to raise more funds. And our other job is to put together partners at a small and mid-sized scale for these projects. And when we talk about affordable housing, we talk about affordable to these lowest incomes where the need is the greatest. Pre-fire in Butte County, there were 2 units of housing available for every 100 extremely low income households that needed them. We currently have over 1,600 households on our county housing waiting list.
It's just unbelievable, these numbers.
I have multiple families in my messages right now that include pregnant moms trying to avoid sleeping in their cars. I got them mixed up because I got so many messages about this issue over the last few days. So our housing is dire. Funding from the state and federal levels has not been useful to low-income housing in general, but certainly we're challenged in the North State to have access to that funding, which flows easier to urban centers. And then, as you all well know, getting access to programs for even further marginalized communities makes it even harder. So it's my privilege to be able to work with an organization whose priority is helping the people who need it most first. Also, full disclosure, it is really hard to start a financing nonprofit in the North State, especially during multiple disasters. So CJ's question earlier about what will help with housing, the biggest answer is money, to be honest. So that's, I think, where we can pull most of our weight. But I hope I'm super supportive of this idea of the Aging and Disability Resource Center, because in my dream life, we can go in, we can meet with the people who are the experts in the housing needs, which are the people who need that housing themselves, and be able to connect them with a local network of small scale developers and funders who can make that housing happen at the scale and with the design that they need the most. So I just gotta say, I'm super looking forward to furthering connections in this group. I already have a list of names of people I want to reach out to. And yeah, again, thanks for having me in this conversation and all of you for doing this really important work.
Absolutely. Thank you, Lauren, and thank all of you for your dedication, because I left this screen up, this slide about how do we achieve these goals, because it just touched my heart to see some of the more recent statistics that are going around. This slide comes off of a interactive tool that you can reach at eldercare.org, and you can type in any community anywhere in the United States. It will allow you to compare up to 4 communities so that you see that monthly expense breakdown or the average of that. Now, I chose to put in a renter who's single, who's in poor health in 2020. And what came up was that out of our northern major counties where the larger populations are, guess what? We're sitting in the most fire ravaged, and we're sitting in the most expensive place to live. And our numbers are actually matching some of the Southern California communities. And I found that shocking. So affordability is critical. Lauren, you know, my heart's wrapped around it. It's like, it has to happen. And I thank you again, Lauren, for also touching on this topic that's becoming more popular. It's almost like a phrase slogan now, and that is equity. Equity in healthcare, equity in housing, equity in education. And Sarah May, my dear sweet friend Sarah, we've talked a lot about what does this even mean, this concept of equity. I think that it's going around so much, and we realize that that disparity is there, especially when you factor in not just poverty, but you factor in ethnicity and racial issues into poverty. It widens the gap even more. You're looking at communities that they're not just coming up from ground level, they're coming from below ground level. So they've got to get to ground level to be even starting to talk at the table. So those are some of the issues that we know must stay in the forefront of this concept that's coming out with those 5 bold goals with the master plan for aging. How can we have affordability in housing? How can we have the shifts in healthcare, the shifts in intergenerational planning, without understanding on a broader level what that equity even means? So please come in, if you would, closing thoughts from our 4 guests on this segment. Rosa, Lauren, thank you so much. Tiffany, Elaine, last thoughts from any of you.
I'd like to put in a plug for HICAP, the Health Insurance Counseling and Advocacy Program, which is a program through Passages in Chico. Passages, as you probably know, is our local area agency on aging, and HICAP counselors are highly trained, and they're compassionate people who can help not only dual eligibles or Medi-Medis, but anybody getting Medicare, because not everybody who gets Medicare is 65, but most of them are. But they can help people with Medicare to coordinate to choose a plan, to coordinate their Medicare plans with the Medi-Cal, and it's all free. And all they have to do is call the HICAP office, and they can talk to a counselor there. So that's.
Thank you for that, Elaine. That was a thought coming in our chat from Tatiana, that it's really important for people to know about HICAP and, you know, where you can get assistance as a dual eligible. So
it's a wonderful service.
Much. Absolutely. Absolutely. Any other comments from you?
Yes.
Go for it, Rosa.
So I want to touch really quickly on a couple of things that most of you have mentioned. This effort here is all inclusive services for our consumers. So it's not just like in our case, it's not just helping them select a plan, but also assisting them and finding all these wonderful resources that are available to them in the area, whether it's via the plan in or just other organizations like all of the organizations that we see here. One of the things that the plans are doing is looking into statistics for those generational gaps that we're talking about here. And they're trying to identify which services are needed the most for the elderly and for the younger people. As Lauren mentioned, younger people are more, educated, they more savvy with computers, but yet the financial part perhaps is not there. Our seniors are more financially, some of them more financially independent. However, the computer part, the technology, abilities are not there. So the plans are working and setting up programs to assist each one of these different groups in the different areas that they need it the most. They're also looking into the different racial groups. I know that they have identified things that are needed more for the Hispanic people, for example, education and for diabetes, nutrition, all these specific services that are needed for each group in our communities. They're working on that. So we are aware of that and we help them, understand all these processes. And the last thing I want to say is I want to say kudos to each one of you who are working in all these, because even though some of us have gone through the disaster situation that we just had here with the fires, we were still out there providing the services to those that also needed, even though we were, in the same need. I know that in Butte County, the social services, for example, a lot of our colleagues there, they lost their homes, but yet they were out there. They are still out there providing services to the people that need them, in the community. And that is a great thing to do, to focus on helping everyone else that is also, in the need of all these services. So part of the things that I do with my staff is to educate them, to understand all these other resources so we can be available to help the client navigate, all the services that are available to them.
Excellent. Thank you so much, Rosa. Any last thoughts coming from you, Tiffany?
Yeah, thank you. I just want to circle back with the kind of the focus of the master plan for aging and like looking at the principles. And I think part of what we talked about and kind of everybody's discussion is like really having that aging is a universal experience. Every single day, each of us age a day. So it impacts all of us. We don't have to wait until we're a certain age, or we don't have to wait until something happens to us. And so I like that the comments earlier with regard to the difference between focusing on independence. We want people to be independent, and yet it's not necessarily a bad thing for them to have that inner dependence. And so I think all of us collectively across the board, and then really integrating aging into all of our systems, and then having our systems talk to each other. I love the fact that we're here today and sharing, and I'm getting amazing information from each of you. But just this ongoing collaboration and this collaborative spirit that really feels like it's going to continue this movement forward. So thanks everybody for the opportunity today.
Absolutely, and thank you all. Such wonderful information. And please know, as we are going through the rest of our presentation, we are recording this for future reference so that you can get through to these resources. I am happy to share this slide deck that's showing you the names and the agencies that each of these amazing people are working with heartlessly day in, day out. And I agree with what you voiced, Rosa, that so many that work in this field, they're in the same situation as the community they're servicing. So they've lost family members, they've lost homes, they've lost possessions, and they have had to bring themselves up by their bootstraps, with hearts that are hurting, and they're still out there and they're still holding the cause. So we're all in
Yes.
this together.
Yes.
We're all in this together.